Kidney stones are not random. They are the result of long-term imbalance in the body. They do not appear overnight. This is a gradual process that develops silently until symptoms become impossible to ignore. If early signals are ignored, the condition progresses. Pain increases, inflammation develops, and the risk of complications rises. But at early stages, this process can be stopped. The most common symptoms include pain in the lower back or side, sometimes radiating to the abdomen or groin, blood in the urine, fever caused by inflammation, and frequent painful urination. It is important to understand that the most intense pain is not caused by the stone itself, but by its movement through the urinary tract. These symptoms can resemble other serious conditions. That is why the first step is not treatment, but diagnosis. Accurate diagnosis includes blood and urine tests, ultrasound examination, and, if necessary, additional imaging methods. Without this, the correct strategy cannot be chosen. Kidney stones differ in composition, including urate, oxalate, and phosphate types. This matters because each type requires a different approach. Everything begins with crystal formation. At first, microscopic crystals appear, then they combine and grow. At this stage, the process is still reversible. If nothing changes, crystals continue to accumulate and form larger stones that cannot pass naturally. This is why early intervention is far more effective than late treatment. One of the main factors is urine concentration. The higher the concentration, the faster crystals form. Increasing fluid intake reduces salt concentration and slows this process. Nutrition also plays a critical role. Excess salt increases calcium excretion, excess animal protein raises uric acid levels, and lack of fiber disrupts metabolic balance. All of this creates conditions for stone formation. The body will not recover if these conditions remain the same. Treatment without lifestyle changes gives only temporary results. Now, the most important part is action, not later, not tomorrow, but now. Start with water. Dehydration is one of the main triggers of stone formation. Increase your water intake steadily throughout the day. This simple step activates natural cleansing mechanisms. Next, improve your nutrition. Reduce salt intake, limit processed foods, and shift your diet toward vegetables, fruits, and natural products. Add movement to your routine. Low physical activity slows metabolism and negatively affects kidney function. Even moderate activity improves internal processes. Monitoring is essential. Even without strong symptoms, your condition must be tracked. Small changes today prevent major problems tomorrow. Ignoring symptoms is one of the biggest risks. Even mild discomfort is a signal, and even rare pain is a reason to check your condition. Before severe pain appears, you still have control. When kidney colic begins, options become limited. That is why early action is critical. Right now, there are only two paths: do nothing and allow the condition to progress, or take control and begin recovery. The decision happens in this moment. Start with one simple action right now. Drink a glass of water, evaluate what you eat today, and make one conscious choice. Small daily actions determine the outcome. They define whether the condition worsens or begins to reverse. The process is not instant, but it is controllable. And the earlier you start, the easier it is to restore balance without pain, complications, or surgery.